Hi, in this video I'm going to show you how to diagnose and fix a hiatal hernia on your own. I'm also going to include and share 3 specific hiatal hernia exercises at the end of this video, so hang tight, okay? It's estimated that 50% of people over 50 years old will be diagnosed with a hiatal hernia in their life, with 95% of those cases, 90 to 95%, being a sliding type 1 hiatal hernia. That percentage rises to 60% for 60-year-olds. So I have some non-surgical techniques and solutions that will help you avoid surgery and medication and get the relief that you deserve. What is a hiatal hernia? A hiatal hernia is when the stomach herniates upward through the hiatus in the diaphragm, causing a second smaller stomach above the diaphragm, trapping the lower esophageal sphincter, or LES. And when it traps that, it allows acid to pass upward through the esophagus. So here's some common hiatal hernia symptoms that you might find. Acid reflux, or GERD, leads to dysphagia, which is difficulty swallowing or eating, esophagitis, which is inflammation of the esophagus, even erosions or ulcers, and even pre-cancer Barrett's esophagus. The symptoms of hiatal hernia vary from person to person. For some, heart palpitations and chest pain can mimic a heart attack. Hiatal hernia can also cause difficulty breathing, stomach bloating, belching. Some people are more prone to hernias as well. So poor posture or scoliosis can make someone more susceptible to a hiatal hernia. Or in the case of pregnancy, or a condition called Ehlers-Danlos syndrome, where their ligaments and tendons are too loose. Other factors can increase the likelihood of developing a hiatal hernia, such as chronic constipation, when you're building abdominal pressure, or heavy weightlifting and not breathing properly, obesity, and weak diaphragmatic muscles. Hiatal hernias can be categorized into 4 types. Again, 90 to 95% are sliding type 1 hernias. Diagnosing a small hiatal hernia of 2 centimeters or even 3 or 4 can be very difficult through traditional testing methods. Many small hiatal hernias are not seen well on endoscopy or barium swallow. Some additional tests are manometry, esophagram, and pH monitoring. But I have 3 methods to help you diagnose a hiatal hernia on your own. 1, we go by symptoms. Do you have 2 or more of the following symptoms? If so, you most likely have a hiatal hernia. Here we go. Acid reflux, difficulty breathing, stomach pain, bloating, belching, dysphagia, difficulty swallowing, and heart palpitations. Number 2, drink a glass of apple cider vinegar. If your acid reflux, GERD, or heartburn gets worse within 20 to 30 minutes of drinking it, then you most likely have a hiatal hernia. And number 3, the finger test can quickly help you diagnose a hiatal hernia. Place your fingers straight into your stomach just below the left side of the rib cage in the center, about 1 inch from the center of your ribs, or xiphoid process. If at least 2 of these tests are positive and you have pain when you do that, you most likely have a hiatal hernia. You can then confirm a sliding type 1 hiatal hernia by getting an endoscopy. Unfortunately though, there are no guarantees that traditional testing and endoscopy will see and diagnose a small hiatal hernia. Anything below 4 centimeters is considered a small hiatal hernia. So how do we fix a hiatal hernia without surgery or medication? There are 3 key elements to fixing a hiatal hernia. 1, posture, posture, posture. If you have bad posture and hunch forward, you must fix that. If you have thoracic or thoracolumbar scoliosis, you need to address that as well. Chiropractic is the most effective way to help and fix poor posture and correct scoliosis, along with Schroth technique. Don't forget, the stomach is attached to the spine via the anterior longitudinal ligament, making spinal care by a chiropractor crucial for complete resolution and recovery of a hiatal hernia. Your diaphragm and your stomach also get nerve supply from the thoracic spine, specifically T6 through T9 spinal nerves. Number 2, the hiatal hernia maneuver. This is an essential part of recovery because during this procedure, we are actually pulling the stomach down below the diaphragm. In chronic cases, we break up abdominal adhesions that may be present. So if you have acid reflux and hiatal hernia, you can go to our website, refluxshield.com, and get the newly patent pending device out. It's the only non-surgical, non-pharmaceutical solution for acid reflux, the only. And number 3, strengthen your diaphragm muscle. With stomach breathing instead of chest breathing, you can start with the following 3 exercises to help you learn how to breathe properly.
Place a foam roll across the floor. Lie back with the foam roll running across the level of your spine that you would like to stretch. Wrap your hands around the back of your head to support the weight. Ensure you do not pull your head forward, keep it in line with the rest of your spine. Inhale, then as you exhale allow your body to relax over the foam roll. Hold this position in a stretch, continuing to focus on your breathing. Lie on your stomach with your forehead on the mat and your arms by your sides with the palms pressing against your legs. Exhale, lift your head and chest slightly off the mat. Inhale, slowly lower your trunk down, keep your head aligned with your spine. Keep your legs together, pressing into the mat. Engage your abdominals throughout the exercise. Sit upright on a stability ball with your feet flat on the floor. Ensure the ball is against a wall. Gently slide forwards until you are sitting on the floor with your back against the gym ball. Place both of your hands behind your head and feel yourself relax backwards into the gym ball. Relax your breathing in this position.